So endoscopic advances in treatment of pancreatic disease is a very important topic. So previously, if we take about pancreatitis and its complications, like it can be just a pseudocyst, a fluid filled cavity, or it can be a pus filled cavity. So whenever this happens, one needs to undergo a open surgery, which will be very morbid. Like these patients are already in a catabolic state, otherwise called as energy losing state. Whenever we do an open surgery, definitely the wound healing will be delayed. Wound infection chances are more. Presence of multiple tubes which come and go into the abdomen are more. Their ICU stay, hospital stay, everything was more previously. But with the advent of advances in endoscopy, all these have come down. Now, in terms of pseudocyst, we may be able to access that pseudocyst endoscopically itself through the stomach. So what we can do, we can puncture the pseudocyst directly from the stomach and communicate these two cavities so that there is no opening outside. Not only this, so can we tackle a pus filled cavity similarly? Yes, we have got some specific stents. So stent is a tube which connects two cavities, and lumen opposing stent means like pseudocyst, if it is full, it is in close contact with stomach. But if we drain it, a doubt can be it can shrink and it can go off. So when we make a hole in an intestine, then intestinal contents may leak. So in order to avoid this, we have something called as lumen opposing stents. So one end of the stent is present within the intestine, the other end of the stent is present within the cyst, and these two are brought together so that the intestine content doesn't leak into the stomach of the patient. So not only that, after putting the stents, one can introduce the endoscope through the stent into the cyst cavity. As we all know, pus can contain some solid contents also. So those can also be completely evacuated using endoscopy itself. So this is regarding pancreatitis. Now regarding advancement in cancers, something called as EUS, endoscopic ultrasound. Initially pancreatic cancers were not amenable for biopsy, or if we want to do a biopsy through the abdomen, it was very morbid. Now with the advent of endoscopic ultrasound, we are able to check the tumors within the pancreas very close, not from the abdomen, from the stomach or from the intestines, and we are also able to take precisely the required amount of samples to prove it or disprove it as cancers. So these advancements have definitely reduced the morbidity of the patient, hospital stay of the patient, charges incurred of the patient, and also the complications. So definitely endoscopic advancements have proven to be as boon in pancreatic diseases.